Hi, I'm Dr. Angela Yakey.
And I'm Dr. Kathleen O'Neill-Smith.
Welcome back to the FIRRIMup Doctors, Good Medicine docu-series.
We are so glad you joined us.
We want to provide you with credible health resources, guide you in your treatment options, and fire you up to take control of your health.
Hi everyone and welcome back. Unfortunately, our Facebook Live is not working right now, but after this finishes today, I'll save the recording and I'll go ahead and upload it. So if you want to come back to it later, or if you had any friends or family that were already getting ready to watch it, you can go ahead and share it with them that way. I do apologize in advance, but we will post it as soon as this one ends today. So yeah, thank you for coming back every week. We always enjoy having the same people as well as new faces. Today we're going to be talking about fascia and pain with COVID-19 virus. Again, our email is FIRRIMupDoctors, FIRRIMup doctors @gmail.com. And our NFIM hotline is still open, which is NFIM GMV, as in Gators Make Victory, @gmail.com. If you have any questions or concerns or would like to become a new patient, you can always email us or call the practice and someone will go ahead and get you set up. And now I will get us started on today's webinar. So I'm going to welcome our FIRRIMup doctors, Dr. Angela Yakey and Dr. Kathleen O'Neill-Smith.
Hi, everybody. How are you? Thank you for coming. Hi, Dr. Kathleen in Boston. I hear it's beautiful up there.
It is fantastic.
Yeah, so here we are. We're on our 23rd week here in North Central Florida, and so appreciate you coming. Yeah, so it's we have some statistics to share with you. Today I'm really excited to talk about fascia and pain. Dr. O'Neill-Smith and I have lectured on this, and so we're going to share some bullet points for you to understand fascia. But first, let's give you an update. Here we are at the beginning of March. Next slide. And we have quite a bit of exposure now with all those red dots here on August 20th. Next slide. We'll proceed to our updates both in North Florida and Boston. So in the US, there's 5.5 million confirmed, over 69 million tested, and 173,626 deaths. That's a lot. Most
That's a lot.
A lot.
And we're only 23 weeks, I'm thinking like 23 weeks into a 40-week pregnancy here. Wow. It's like 23 weeks. Wow.
Yes, but look at what we're doing in Florida, Dr. Kathleen. We've done 4.3 million tests, over 500,000 confirmed, 35,620 hospitalized, and we're now surpassed, we've now surpassed Massachusetts with 10,049 deaths, because we were getting recently there, so it's unfortunate. We've been busy in Alachua County, 4,813 confirmed, 31 deaths, and somewhere between 20 and 30 COVID patients. Most are doing amazingly well, and I'm really happy about that. A total of 3 hospitalized, 2 went to intensive care but didn't need to be intubated. Nobody got intubated, and we haven't lost anybody, so really happy about that. And the other things we've noticed is that we've gotten some calls from exposures from spouses of, like, for example, the husband gets COVID and gets sick, and the wife is one of our patients. She gets exposed, but she doesn't necessarily get sick. And so we'll keep emphasizing fortifying the immune system. So just because you're COVID positive doesn't mean you necessarily have to be sick. And that's the point of our book, Kick COVID-19 to the Curb, is to fortify your, what to do, your 14-day monitoring guide should you be exposed. So now more than ever, Dr. Kathleen, our guidebook has come in really handy.
It's really handy. It's really handy. But one of the things I found over the 23 weeks since early March is that you can have 2 people living together and one may have COVID and one may never show any signs. So there really is, right in here in the oronasal pharynx, the mouth, the nose, the airway, the GI tract, which is the mouth is the first part of it, and the throat. you really can protect yourself. So if you are really healthy, it's possible that you may never really have COVID, be able to hijack your cells and your immune system. That's why our book is really important. Teaches you how to do that.
Yes, and I wanted to emphasize it's now available on Amazon Kindle for $9.99. So if any of your friends or family tell you they're sick or they got exposed by accident, just have them pick it up. I think it's a really great resource based on what the patients and the readers are telling us.
So in Boston, yeah, we're pretty stable right now. I'm sure that's not going to remain. I did actually take a walk during this past week. At night, I started to go for a walk down in the north end of Boston, which is an Italian section. And August in Boston is Feast Month. We celebrate the feast of the Mother Mary, yeah, Saint Anthony and Mary, and it's just it's been a wonderful event over the years down in the north end, the Italian feasts. But so I was curious what was going on down there. So I went down there this week, earlier in the week, just to kind of have a walk, and I was shocked to see how many people were down there. The streets were loaded. Maybe 2/3, 3/4 of the people were wearing masks, but it was really just a whole new ball game compared to what we've been doing in March and April and May. In the burbs where I am, 5 to 8 miles from Boston, near Boston College and some of the other schools, it's pretty quiet, but I was really surprised how busy it was downtown. I had no idea. So I don't know that our numbers are going to last as all of the many colleges return to the city over the next couple of weeks, but we'll see.
And we're going to experience the same here in Alachua County. We're the home of the Gators, the University of Florida. So I'm expecting a little bit of a surge with the students coming back, but they're COVID testing everybody, especially at the University of Florida. So yes, we'll see. Next slide. So here we are in Alachua County. The case fatality rate is still good. It's 6 out of 1,000. We did have, as of yesterday, we had 15 new hospitalizations, and today 8 so far. So we're doing okay though in terms of case fatality rate still being 6 out of 1,000. Remember, it started in Wuhan at about 6 out of 100. So we're doing pretty well considering. Next slide. So today we're going to, a lot of the patients, when they call and they start having COVID symptoms, they actually say they just hurt all over, like they got beaten up. If you haven't experienced COVID, then you might have experienced the flu, but basically your whole body hurts, right? Why might that be? And so today we're actually going to talk about fascia or soft tissue. Next slide. So fascia is a tissue that connects every muscle, bone, organ, and nerve in the body. And so we're going to talk about the anatomy. Next slide. So in this slide, you can see it kind of looks like meat. It's that white connective tissue that's on top of the muscle, for example, in this picture. But you can imagine also that it's surrounding every muscle, every vascular nerve bundle within that muscle. So it's not only on the outside that you could see, it's actually on the inside as well. So during the 3rd week of formation in your mother's womb, you actually folded multiple times, over 600 times, such that, next slide, such that the fascia or soft tissue is one contiguous sheet of tissue. And it's important because of some concepts with pain and inflammation that we're going to explain. So this is David Lizondak. He actually introduced me to the concept of fascia only 2.5 years ago at a conference here at the University of Florida in integrative medicine. And I spent a day with him, and it just opened my eyes that day because his teaching on fascia had me realize that the acupuncture meridians actually does make sense. It now makes sense because we're one contiguous sheet, that if you put an acupuncture point in the foot, it could actually trigger some neurochemical change in the brain. So I love David. He says, "You are the most elaborate piece of origami ever." And so I consider David my my mentor and guide in fascia land, because it really changed the way I look at patients, the way I look at you all in terms of pain, wellness, and well-being and healing. And so he had asked me a couple months after that to be the co-editor of a textbook for doctors that I'm going to talk to you guys about in a minute. But basically, the folds is what we're trying to give you in terms of this concept. The next slide. Many of you are from Gainesville, and remember the University of Florida Stephen C. O'Connell Center, before it was renamed and changed, the roof is now like cement. But in the old days, because I grew up here since the 1970s, it used to be kind of like parachute material. And you remember during hurricane season, we would all brace to see if a tree branch would land on one side of the O'Connell Center, and then it would poke out on the other side. And then it would change the whole structure of the building because of that. And that's an engineering term called tensegrity, where if you affect, for example, some of that on the east side, it would affect everything all over the place, including on the west side. And so it's important to understand that when we talk about our bodies. Next slide. So this slide actually depicts the fascia as a cat suit on the outside of the body, which is showing something called biotensegrity, because it's biological tensegrity. But remember, the fascia is on the outside like a cat suit, but also on the inside, surrounding every tissue in your body. So on this concept, then you might understand why. I'll give you my own example. One of my students in math club in fifth grade, so this was about 12 years ago, dropped a bowling ball on my hand. Down here, for example, if you had an injury on the hand, over the next 6 weeks, I developed forearm pain, shoulder pain, then chronic headaches. And that's the concept of biotensegrity, is that one time that where you get hurt on one part of your body could actually lead to pain and discomfort and imbalance in the rest of your body. And I know most of you on the call have experienced it, be it from injury like a bowling ball injury or whiplash injury or back injury or anything like that, or tendonitis. So that's the concept I wanted to stage so that Dr. Kathleen can spend a few minutes talking about the next slide.
No, let's stay here. Let's stay here.
Okay.
So one of the things, I'm a physiologist as well as a physician. And one of the things I want to just look at in this slide is big picture, 40,000 feet and 5,000 feet. So when I look at this picture and I think of this glide and, Dr. Akey talking about what happens in one side always happens in another side. Essentially, when we talk about when we use the word bio, it means living. We are living beings, and life affects life. The life of the people in the home that you're living with affects you. If their mood is good, your mood is good. If their mood is off, it affects your mood. We all affect each other all the time. And it's the same concept for the body, for biotensegrity. One effect in one place, any part of this bodysuit will affect another part of the body. And that's really important. Now, so this is a whole suit that's all contiguous and connected, as Dr. Akey said. Now, when you look at these lines, and I don't know if you can just point out the lines, not in the body, but around the body that are flowing through it. I'm going to go to 5,000 feet with this concept of the fascia. The fascia is, those lines there to me are like lines of, I think of it as spaghetti in a bag, long, thin strands of spaghetti in a bag. Each of those lines of spaghetti are minuscule. You can't even see them under a microscope. And they make up this tissue, and they make up your muscle tissue, and they make up your organ tissue, and they're all made of the same thing. So all of the ingredients that make us up, there's only a number of them, and they're all made of the same thing. But the point is that between each layer, so let's say all of those spaghetti strands are all pieces of fascia, and they all make up a muscle. And there's thousands of them that make up your biceps muscle, or that make up your quadriceps muscle in your, one part of your quadricep muscle in your thigh. The reality is that each of them, around them, have this fluid And in that fluid are your nervous system, yes, for pain, but more importantly, that is signaled by the immune system. So we can relate this to COVID-19. We can relate this to the symptoms of COVID-19, because why, when you get an infection, whether it's the flu or whether it's COVID-19 or whether it's a pneumonia, do you get muscle aches? You get muscle aches because the immune system is flowing in and out and in and out like this beautiful origami of David Lasondak and Dr. Akey, basically that flows between these particular fibers. Any fibers, not just the muscle fibers, but the fibers of every organ system. So when we come back to the immune system as a whole, and pain that goes along with infection or inflammation, when you injure a muscle, like Dr. Akey told about basically the bowling ball injury, or immune problems like autoimmunity, any problem in any system is spread throughout the body. It's going to be in all systems potentially. You're going to feel it, and it's going to manifest in your weakest link. And in your weakest link, that's where you're going to have the symptom. So, or in a direct point of contact, like the bowling ball on the hand, you will feel it there, but you can feel it in other places because the hip bone's connected to the leg bone's connected to the, blah, blah, blah. We know that. So the reality is this is all connected. This is all living tissue, bio. This is all what affects the front will affect the back. What affects the back will affect the side, yada, yada, yada. So the immune system in any infection will affect pain, will affect, what happens in the long run, how we clean it up, and it's critically important. And the thing I want to show you on the next slide, which looks really complicated, but it's not. If I could have gone into this figure, and if I could have highlighted different things, I would have. But I'm going to really break this down, and I'm going to highlight key words. This is just an example of an injury that happens, whether it's an infection or a bowling ball injury or an immune system injury like a Hashimoto's thyroiditis or a Graves' thyroiditis. There's an acute phase, there's a subacute phase, and there's a chronic phase. The acute phase is generally several days. The subacute phase is during the subsequent week, like in COVID-19, does somebody get symptoms, and then are they cleaned up by the body, by this living structure? The chronic phase is, did they not get cleaned up appropriately, and does the person end up with now immune issues in the heart from COVID, immune issues in the kidney from COVID? Do they end up with some complicated term called myalgic encephalomyelitis, which basically is just the fascia? Myalgic encephalomyelitis, such a complicated word that we kind of, for people who have really severe immune system problems and chronic fatigue and you name it, is just basically like, go back to the last slide, please, that this whole fascia from the brain, from the top of the head, through the entire body, whether it's the chest, the abdomen, the legs, regardless of the organ system, there is communication through this white tissue to cause an inflammatory response in an area of a weak link, an Achilles heel within that person. So it's really important. So we want to help people, Dr. Akey and I, understand that we can protect this entire white suit, this cat suit, by protecting our immune system and creating immune system resilience. Next slide. So here, in an acute phase of an injury, which we all suffer, whether it's being exposed to a bug and getting an infection, or having, an autoimmune problem, or a bowling ball or a direct injury to something, we will end up having something happen at that level. And we'll use the muscle as an example of an organ. Instead of the thyroid, instead of the pancreas, instead of the heart is a muscle. So whatever I say about the muscle, you can assume can happen in the heart. So the muscle, when it gets injured, whether it's an infection, becomes a little bit weak. It doesn't work well. The activation of that muscle will be, there's a reflex response that activation gets reduced. And then it tries to get cleaned up. And if it can't get cleaned up, what happens is fat begins to infiltrate that muscle. if you go back to that earlier piece of meat, which we don't have to do here, that we showed as a slide, that Dr. Akey showed as a slide, you will get more fat infiltrating through that piece of chicken with all that whiteness through it. So you can have a really solid piece of chicken meat, which is muscle, or it can have fat going through it. So if this doesn't heal readily, within a short time, we're going to have fat deposition in our muscle, or we're going to have fat deposition in our heart, or the liver is going to get fatty. But basically, we will get fat deposition. And in response to that fat, we're going to get inflammation because the heart muscle shouldn't have fat in it. The quad muscle shouldn't have fat in it. The biceps muscle shouldn't have fat in it. The liver shouldn't have just general fat in it. So basically, when we get fat somewhere that's going there to protect and to cushion an injury, we get inflammation. And when we get inflammation, again, there's this whole series of responses. The muscle gets fatigued, the heart gets fatigued, the thyroid doesn't function well, you get hypothyroidism, you get, whatever it is, the heart doesn't beat as readily, as strongly, and the heart rate goes up. Then, as we increase more and more fat deposition in an organ, whether it's a muscle or an organ, we then get tightness, we then get fibrosis, we then get an organ or a muscle that doesn't function as well. If the bicep doesn't heal, if it's not able to lift the same amount of weight. And the thyroid isn't able to handle the same amount of stress. So you get a compromised dynamic of that organ or that muscle. And it just keeps going around and around. With a muscle, it creates pain because between each of those spaghetti fibers or muscle fibers within the fascia is where the neurons sit, the pain receptors. And the nerves give you a feeling, a sensation of pain. And that sensation of pain is a signal. It's a signal to say, oh, this muscle was, this hand had a bowling ball fall on it. The muscle is injured. Please take care of it. When the thyroid doesn't function well, it's not pain because the thyroid doesn't feel pain. The thyroid just reduces its function. And when you find that in the lab work, you need to say, oh, something's going on, like a bowling ball to the thyroid. How am I going to help it? How am I going to heal it? And generally, it's an immune system resilience in the program of healing or in the therapeutic plan that you need in order to heal that. So pain is always a signal. Fat infiltration of an organ or reduced function of an organ is always a signal that we need to pay attention to the immune system, which is the inflammatory system, in order to help and heal a muscle or an organ so that it can restore its function and not become fibrotic and function optimally and not have reduced function. And that's the key. Now, one of the things I want to say about this whole, dynamic in this if I had the pointer, I would show you, it's an injury. So injury up in the top, the very top, the injury basically on the left goes to adipose, or you deposit fat down in subacute chronic phase. And then the fat goes to inflammation, the second box down. In the inflammation goes all the way over to fibrosis in the far upper box. And that fibrosis goes down to the third box, a compromised tissue or organ. It doesn't work well. Hypothyroidism, the heart doesn't work well, the blood vessels don't work well, hypertension. And then ultimately, you can feel pain, which is dead smack in the middle, because those receptors in the fascia are signaling, but you can also just have that there's no pain because some organs don't exhibit pain. You just see the reduced function by the numbers. So what we want to do is improve the immune system response to reduce fatty infiltration of a muscle or an organ, to help and heal the inflammatory response in any tissue, and to reduce pain in any tissue. Movement and flow and exercise and activity and walking all help that. Touch, gentle massage will help that as well. There are many things that will help that. But understanding that this is the basis of injury and the basis of why you want immune system resilience is really, really important. Lots of this is just discussed in the book that Dr. Akey authored or edited with David Lasondak, and that's really, there are some wonderful charts in there and just unbelievable examples of, you know, new things that we can learn. Just really, really important to try to maintain the best body composition possible and reduce fat infiltration of any organ system within our body.
Wow, Dr. Kathleen, that was so poetic. What a beautiful explanation in regards to whether it's a physical injury like I shared, or COVID-19, or inflammation and autoimmunity, about how the body moves from acute to subacute to chronic, and how the interventions we talk about will hopefully hold it and heal it. And so just one thing I wanted to share about the bowling ball injury is that it makes sense that whenever I'm about to get sick with anything, my right third finger where the crush injury occurred is my weather vane that I need to stop and slow down because I'm about to get sick, because it is the Achilles heel of my body functionally right now. So thank you for sharing that. That was a great job.
Thank you. I hope it helps people understand why to be well and why to use the concepts in Kick COVID-19 to the Curb. They basically underlie that whole graph.
Yes, especially the section 2 on Immunity 101. So 2 years ago, after I met David, he asked me to be the co-editor of this international effort. There's over a dozen authors who are really good at fascia. And I happen to be the new kid on the block, but I had training in integrative medicine very similarly to Dr. Kathleen's integrative functional medicine. So I'm really happy to announce to our community, Dr. Kathleen here on FIRRIMup, that you and I wrote the hormones and fascia chapter. Why perimenopausal women get hurt and what to do about it. They did a pre-sale on Amazon, and we're actually #1. It's a #1 new release in sports medicine on Amazon. So shout out to David for asking me to be a co-editor on this landmark medical textbook. It's a first medical textbook on fascia geared towards the practicing physician, so MDDOs. There were a lot of contributions by structural integrative therapists. So those are massage therapists, physical therapists, etc., who have concepts in integration, because I'm convinced that you cannot understand integrative nor regenerative medicine as well as you could unless you understand the fascia. And I believe Dr. Kathleen did a great job explaining that. It's beautifully done. Next slide. So yeah, that book is actually being released tomorrow. The pre-sales put us at #1 in sports medicine. So I'm happy to release the publication date is actually tomorrow.
Well, big shout out, congratulations, that's wonderful. And I know, Dr. Akey, that you understand those concepts because we talk about them incessantly, because that's what we do. But for the community, it's really just fundamental, and hopefully that was a beginning, you know, for understanding why it's important to move, why it's important to eat well, because we are bio-living objects, and why it's important to create immune resiliency, because you will maintain your body composition of all of your organs and muscles in a healthful way as much as possible.
Perfect. Our time is short. We'll try to answer some of the questions next week, and try to stew on what we were teaching you about the fascia. For now, then, you all be safe, be well, and God bless you all. Dr. Kathleen, thank you for coming in from Boston, and I'll have Emily take it from here. Thank you all for coming. And we'll place this on Facebook so you guys can watch it again if you'd like.
Thank you all.
Thank you to both of our doctors for being with us today. Yes, unfortunately, we didn't have time to get to Q&A, but if you do have any questions, you're always welcome to email us at firrimupdoctors@gmail.com. Or for those of you on Facebook, you can always send us a message in our private message, and we will try and get back to you on there as well. So as they were mentioning, Dr. Akey's book, well, the book she helped co-edit, comes out tomorrow. So we have a 20% discount code if you would like to purchase that, available on our website, FIRRIMupDoctors.com. The discount code is going to be SCI20. And if you use that code, it'll give you the 20% discount that you're looking for. It's a great book, so everyone should check it out. And once again, our Kick COVID-19 to the Curb is still always on sale and always up for grabs because COVID is still a real thing. So yeah, if you purchase our guidebook, either paperback or ebook version, you can go ahead and take 20% off of our ultra potent vitamin C and zinc AG. Again, the paperback version is $29.99 and our ebook is $9.99. We are listed on Amazon, Google Play, and Barnes & Noble. So you have 3 different formats or places that you can go purchase the book. To get the 20% off, all you have to do is show some sort of receipt that you purchased our book, and we will go ahead and honor that 20% off code. And that is our time for today. Again, I will go ahead and upload this video to YouTube shortly after we get off of here. Not YouTube, I'm sorry, I meant Facebook. Shortly after we get off of here. Hopefully next week it will be back up and running. But we'd like to thank you all again for coming out each week. We really enjoy having our little audience that supports us, and it means the world to us. So everyone be safe and have a great weekend.
We're so glad you joined us today.
We hope we've given you the tools to take control of your health.
For more good medicine and information about any treatments, supplements, and resources discussed today, please visit us at www.FIRRIMupDoctors.com. That's FIRRIM updoctors.com.
And wherever you're listening from, remember to like us on Facebook and subscribe to our YouTube and podcast channels so you don't miss out. The information provided is not a substitute for professional medical advice. This should not be used to diagnose, treat, or manage health problems without consultation. If you do experience any of the symptoms discussed today, please contact your nearest healthcare professional.